Good afternoon, everyone, or good morning still if you're in Perth, and welcome to our webinar on privacy and security in My Health Record. And we're letting people into the meeting. It does take, as you know, a minute or two to do that. And while we're doing that, we really encourage you to get started in the chat. The chat will be pretty lively today, so it's a good opportunity to get started in the chat now. We'd love you to introduce yourself and your pronouns. If you're representing an organisation, let us know where you're from. If you're representing yourself, that's equally cool. If you know which country you're on, let us know. I'm in Nam, the land of the Wurundjeri people of the Eastern Kulin Nation here. We will be doing some Q&A later on, so we'll get you to ask questions later on the Q&A, and we'll ask you at various points for your thoughts through polls and just general conversation. So we hope today will be very interactive for you, and you'll feel like you've learned something and maybe had a say as well to those that are comfortable. So just keep letting people in. There's still a few more people to arrive. Hi, Victoria. Lovely to hear on Bunjalong land. As we do that, I'm going to start slowly doing the introductions. So today's webinar is about how to best use the privacy and security features in My Health Record. And I'm really pleased we're doing this because so many people don't realise these mechanisms are in place and don't use them. And maybe they don't need to use them, but it's always good to know that they're there in case you ever do. And for some of you might be the local help desk for your friends and family, so you'll learn some things that you'll be able to then also provide to them, which might be helpful too. My name's Elizabeth Devaney and I'm the CEO of Consumers Health Forum, and I'll be hosting today's webinar. We'll be recording this, as you can see, and afterwards we'll be popping it up on our YouTube channel. So if you have to leave for some reason during the day, or if you want to let someone else know there's a really good webinar, you'll be able to share the link with them, which is terrific. We love as many people as possible to watch these. I would give you just a reminder that we don't allow AI scribes to register or be used in the webinars unless they're permitted because you need them for accessibility reasons. So if anyone happens to have a scribe and you try to join it, you'll see that we will remove it. So I'll just let you know that too. So we've got probably about half of the folks here, and it's 3 minutes past, so we are going to get started. Thanks, Shannon. That was exactly what I was going to do. I would like to acknowledge the people of Nam, and particularly the Wurundjeri and Boonwurrung people of the Eastern Kulin Nation, as they are the traditional custodians of the lands from where I'm coming from, where I live and work. And I would really like to acknowledge their leaders, past, present and emerging. I'd like to give a special warm welcome to First Nations people who are here with us today and recognise the connections that many have to the lands wherever they work across Australia. So now on to today's webinar. My Health Record is what we're discussing. And in this webinar, we hope to provide you some practical tips on how to get the most use out of My Health Record, particularly around privacy and security. And we're giving you this webinar in partnership with the Australian Digital Health Agency. My Health Record is a powerful digital tool, and many of you who've used it will know this. And it can help you manage your health and give not only you, but also those people looking after you, supporting you with your care, access to really important health information. So we hope that you'll have better information at the end of this on how to use those settings if you need to manage your own health information. So we hope to do a few things. We'll be working with some consumers who have a lot of experience using My Health Record. You'll hear some presentations from experts from the agency about how to best use these functions. And then at the end, we'll be having a bit of a panel discussion and answer as many of your questions as we can. So we really encourage you, as you have a question, to pop it in the Q&A. Sometimes we find at the end of the day, we've got more questions than we can answer. So get yours in early. Sometimes we theme them up. There's a few that are similar, we'll theme them up. Sometimes we'll answer them in the chat if it's one that can be quickly answered by either us or perhaps one of our colleagues from the agency. And sometimes we'll answer them afterwards. So perhaps if it's something, a link or something, we might send it to you in email where you get your copy of the link to the YouTube channel that this recording will be placed on. Really great to see 11 people putting their details in the chat. That's fantastic. There's 38 of us online, so that means there's 27 of us who are yet to pop their information in the chat. So if you missed that at the start, folks, please pop into the chat, introduce yourself, your pronouns. If you're representing an organisation, or if you want to say why you're on the webinar today, we'd love to know a little more about you. You know what country you're on. It's always great to see all the different lands that people are on. So do share that if you can. And we've also got reactions too, one of the things that Zoom offers. So there's a button down the bottom that's got a bit of a heart on it. If you open it up now, it'll show you different kinds of reactions that you can have. She says, and then mine's not working for some reason. Yeah, someone's got a heart, fantastic. So I encourage you to just play around with them now. Let's have some fun. Use them all, do whatever you like, and just get a sense of them, because as people are presenting, if you like something they said, give them the thumbs up. If you're a bit concerned, maybe give them a surprise face. It really helps, because we're not all together in the one room. People can't see your face. They can't see if you're agreeing with what they're saying or not. So it helps to share your emotions using the emojis. Sometimes I'll ask you to do that, but feel free to do it at any point in time and give the presenters a bit of love. Okay. Now, just before we start with our first presentations from our consumer reps, we're going to do a little bit of a poll. Thanks, Christy, for putting your details in the chat. We're going to also reveal these results of the polls as we go. So the first one asks you about your use of My Health Record. So it'll pop up on your screen shortly. We'll give you just a few seconds to put your answer in there about how much you use the record. Use it, not much, a lot, don't know, never used it. And we'll share that with you shortly. For those of you that are just arriving, we've got a poll up there, and if you haven't done already, we really encourage you to go into the chat and introduce yourself and tell us your name, where you're from, what your pronouns are, where you're coming from, whose land you're on today. And we also encourage you, as you've got questions, to pop them into the Q&A and to feel free to have a conversation in the chat about key issues as we go. Great. So let's get on with the show. I'm really delighted to introduce our two consumer members for today's discussion, Andrea Cooper and Ali Finnis. You can see from their bios, which will be popping in the chat now, that they have diverse healthcare consumer experiences and can talk about using My Health Record as a digital health tool. First of all, Andrea and Ali, thank you so much for joining us today. And to start off, I'll ask you to introduce yourselves to the audience. So, Ali, can I ask you to introduce yourself first, and then I'll ask Andrea.
Sure. Hi, everyone. Thank you, Elizabeth. I'm Ali. As Elizabeth has already said, I use they, them pronouns, and I'm based on beautiful Bowendick country in southeast South Australia. I've been working in various advocacy spaces, including mental health, disability, and chronic illness, and as a healthcare consumer for the past several years now. The work I do is primarily lived experience-based, and something that I'm really passionate about is trying to use what I've gone through, both the good and the not so great, to try and improve outcomes for others. Additionally, I love both spreading awareness and learning new things, which is part of why it's so great to be a panelist on today's webinar, because I know I'm going to walk away with so much knowledge about my health record and how I can better use it, hopefully for my own benefit as a healthcare consumer. So, as well as supporting others that I know too. So, my use of my health record has admittedly been somewhat infrequent, and I guess that's because I haven't really formed a habit of using it. I know it's out there as a tool, and I know that the clinicians and other healthcare providers I work with do too, but for whatever reason, we just haven't adopted it yet. And I hope that after today, I'll feel much more empowered to make it more a part of my healthcare process, I guess. Thank you.
Fantastic. Thanks, Ali. And I'd love you to give them some thanks and encouragement by using the emojis. And now, Andrea, perhaps could you say a couple of words about yourself? Thank you.
I certainly can. I've been active as a health consumer now for several years and building on my own experience of the health system. And I'm active in a number of organisations, both in projects here in Victoria and nationally. And just for example, they include Dental Health Services Victoria, Alfred Health, and nationally the Multicultural Health Collaborative, as well as the Deafness Forum. My professional background is actually in communications with a specialisation in inclusion. And that means looking at how we reach people from diverse backgrounds, diverse cultures, communication disability, or have limited English literacy. And that's highly relevant in everything we do, in particular digital health and access to my health record. I personally opted out of my health record when it first started. As I recall, I think I was a bit security concerned, but also was just really unsure how it would work. I only signed up a couple of months ago. I'm totally unsure if I've actually signed up correctly. There is literally no information or very little information going in to my own personal record. So I'm really interested in filling the gaps and understanding how it works from a functional perspective. And then I'm also keen to learn what I can today and hopefully share that with others. So thank you for having me.
Fantastic. And again, love people to show Andrea some love and welcome her to the presentation today. Thanks, folks. So we'll just pop our poll result up now for those of you that are curious how much people have been using their My Health record. Shannon, if you've got that there handy. Thanks. So you can see we've got people, some people regular users, some never used it at all. That's really great to get a sense of who's in the audience today. Thanks, Shannon. Now we're going to move on to our first presentation by Kan. Kan Van Venti is from the Australian Digital Health Agency and works in the Partnerships and Education Policy Programs and Engagement Division. And gee, I'm glad I don't answer the phone and have to say that, Kan. We'll be checking in with Andrea and Ali during the presentations, and they'll be putting some questions to our presenters. So first off is Kan, who's going to start the presentations for today. So I'm going to pass across to you. Thank you.
Thank you, Elizabeth. Let's see if we can get my face. Yes, there I am. Hello, everyone. My name is, please put your thumbs up if you can hear me and see me, just to double check. That looks good. Thank you very much. All right, so let's get started. So welcome. My name is Koen van Venetië, as already introduced by Elizabeth. I'm a digital educator with the Digital Health Agency, and today I'll be talking to you together with my colleague Tracy Weeks about how to protect your digital life. Now, we will focus primarily on three big topics, namely privacy, access controls, and security of your My Health record. But as you may have already noticed, there is also some interest in more generic kind of overall information about how to use My Health record. So I'll just give you a quick intro again into what it is. And we've had a very interesting webinar a couple of months ago on this very topic. It's you can actually view the recordings, I think, still online. Please fill me in there, Shannon, via the chat if I'm not correct, but maybe place a link if people are interested so they can review more on this topic. But yeah, let's start with a quick introduction into what My Health record is. So what is My Health record? My Health record provides an online summary of a person's health information, including things like your medical history, doctor's appointments, current medications, test results, and much, much more. So that is all controlled by the person, by you, which is a key element of the system. So this means that you have a say about who has access to your My Health record, what gets uploaded, and what stays in your record, and also who can see it. And we'll talk quite a bit more about that later today in my presentation. The third blob here, you may guess already what this is, but this is all about that the My Health record is part of a national system, meaning it travels with the individual or you wherever you go. For example, if you have a general practitioner in Western Australia, but you go on a holiday and you need to visit one in Queensland, both doctors can actually access your My Health record and therefore your health information in your system. Now, your My Health record is always available to you. That means you or your authorized representatives and healthcare providers involved in your care can access that information. The record can be viewed and updated subject to access controls that you set. Again, we'll talk more about that, how that works. And finally, over here, protected. So the health record is protected and safe. And importantly, your record is protected by legislation, primarily by the My Health Record Act. My Health Record is secure for multiple layers of international best practice in IT security. For example, we have a cybersecurity center which monitors, maintains, and improves the system 24/7. These include strong encryption, firewalls, secure login processes, and audit logging. All data within the My Health Record system is stored securely in Australia. So now we know what it is. Let's talk a little bit about what's in it. And I already mentioned that is quite a bit. So this slide shows you the list of available documents in your My Health record. These documents come from 3 different sources: healthcare providers, Medicare, and the consumer, which is you. So your healthcare provider enters data, things like clinical documents, such as health summaries, discharge summaries, test results, specialist letters. All these kinds of documents coming from different kinds of healthcare providers find their way into your My Health record once you've set it up. There's also Medicare sourced information, which includes immunization information, as you can see here, which comes from the Australian Immunization Register. Also medication information from the Pharmaceutical Benefit Scheme claims, or the PBS. And then there's Medicare information from Medicare, My Medicare, correction. My Medicare is where it's sourced from. So you can only view the information from your healthcare professional and Medicare in My Health record. However, there's also information that you can enter yourself to kind of, well, it's additional information to these records and documents that have been uploaded by healthcare professionals. This so-called consumer entered data can be information like personal health summaries, which is where you can add information about allergies, adverse reactions you have experienced, or medicines you are taking. Then there are personal notes, health notes. These are your notes about your health. Only you or your representatives have access to this. So not your doctors, your other healthcare professionals have access, just for you and your representatives. Then there is emergency context down here, and also advanced care planning documents. These are also documents that you can actually detail yourself. So all this information you can add yourself to your My Health record, and it also makes it more customized to your need. So let's have a quick look at the My Health app before we dive into the next part of the presentation, which will be more on the privacy and access controls. So what is the My Health app? My Health app is an agency-owned and managed app. It is the latest digital tool developed by the agency to help you and your carers engage with and be proactive in managing your health. It features a mobile design, which is largely focused on being user-friendly and also being more accessible. You can download documents from your My Health record with your My Health app onto your device. Further, do you have the ability to actually add emergency context via your phone or the app if you use it on a tablet, for example. You can also add, edit, or remove allergies and medicine information. You can store electronic prescriptions that you get prescribed via, for example, your GP. And you can present these also via the app at your pharmacy. And further, is it possible to share health information documents with your healthcare professionals? So if for whatever reason your healthcare professional or healthcare provider that you're seeing does not have access to your My Health record, you might still be able to share information with them from your My Health record via the app. This app is as I said, it's the latest tool by the agency, and it's becoming the key point of access. That you can also access it via the desktop and via MyGov. That's more, well, that's how it used to be. We're moving more towards a mobile first kind of approach, I would say. And the beautiful thing is that there's constant releases of new functionality in there. It's getting more extensive and extensive and extensive. And one of the great things that has only recently been added and is not on screen here yet is that you can actually book an appointment with the healthcare provider using the app as well. So now we're diving a bit more into the topic of today. You can see here some privacy and security tips, and I'll let Tracy later on talk much more about it. So I'll keep this very short and snappy. But one of the things to keep in mind and to stay safe while using the app would be if you're using a shared device, you got to make sure that you always use your unique entry PIN to access the My Health app. Further, is it always advisable to always log out after using it? So don't leave it on in the background. Yeah, it just it might not be as safe as you think. Further, is there always the disclaimer: be careful when sharing your health information using the app. Things like be very careful that you have the right contact details of the person you're sending it to. And there's a range of other things to keep in mind when you do that. Make sure you actually send things that should be shared. Yeah, things like that. Be very mindful of that. So let's dive a bit more into privacy and access controls. So this gives you a good overview of the different access controls and privacy and access controls that are in place. And as mentioned before, you can control who accesses your My Health record by adjusting privacy settings. This way you can manage which healthcare organization can see your record. Let's start with the first one. So one of the ways you can restrict access is by using a so-called limited document access code, or LDAC, as you can see here. This is where you can create a code to restrict access to specific documents in your My Health record. So that could, for example, be a test result that you do not want to be visible to every other healthcare professional that has access to your My Health record. You can then share this code with the healthcare providers you do trust and you do like to access that document, and they can access it from their own. Let's go to the next one. Another way to control the access to your record is by actually setting a record access code. Again, this is a set code to limit access to your entire record. And once you've set this up, only those with the code can view your whole record. Now, when a healthcare professional has entered the code once, they will not need to enter the code the next time, which means that they just have access from then on to your My Health record. So as a consumer, you can choose to remove documents at any time. There is a process for that on our website, and I'm sure that Shannon can share our website's URL in the chat. Just to give a quick rundown of how it would go. You would go to your MyGov account, get access into your My Health record, and if you have access to your My Health record, that's the way you usually get in. Then make sure you select the Privacy and Access tab in the top navigation menu, and you select Manage My Document Access. In there, you can actually find the document you like to manage the access of, and you can actually say Manage Access in there, and Remove Document is the next option. Then you select Save, and you get a little warning message whether you really want to remove it, and you select Yes as to confirm that. Again, on our website, there's much more information about this. Receive an alert when your record is accessed. This is an interesting one. So you can set this up. This is not set up by default. And what it does, it kicks off a text message to you or an email to you to alert that someone has accessed your record or uploaded a document into it. And this is, yeah, I think a very useful way to know, to actually keep a track of activity in your record. Together with that, once you know that someone's been in there, you want to get more information about it, you can go into the access history. So access to your record is constantly monitored and logged. For example, the information on the access history page of your My Health record shows actions from the past 12 months. And I'll give you a bit more details on what's in it later on. But that's the place to look for who's been in there and what they've done. Now, where to find your privacy controls in your My Health record? You log into your MyGov account again. Select the My Health record tile in there of the linked My Health record. Click on your My Health record or the record of someone you are representative for. Click the Privacy and Access tab in the top again, and that's where you find all the controls you need. Now, if that doesn't work, it may be that you want to make sure that your My Health record is actually linked to your MyGov account. Verify your identity using a range of information and documents if needed. This is only the case if it has not been linked and set up yet. And then once that's done, you can actually set up the My Health record. This means that from here on, only you or your nominated or authorized representative can access your My Health record via the app. And once you're in My Health record, click again the Privacy and Access tab in the top menu to get access to all these functionalities. Now, another quite hot off the press topic is share by default for pathology and diagnostic imaging. So this is not an access control per se, but it's an interesting topic to talk about. And I just want to give you a bit of information about it. So pathology and diagnostic imaging service providers will soon be required to upload reports to your My Health record after you visited them. So required means they have to do it. Faster access basically refers, and you can see here, the benefits, some of the benefits are faster access to some of the tests. So it refers to the potential removal of the existing delay on these reports for you. So currently, a pathology or radiology report is uploaded to My Health record as soon as it's verified. Of course, that's only happening where a radiology or a pathology provider is registered and connected to My Health record system. You can see with the new law in place and regulations following out of that, rules following out of that, and this process is not rounded up yet. It's in process as we speak. So once this is all put through, you can see immediately that a report has been uploaded, but there will be a little log icon on the report. There's a so-called 7-day wait period. So once the 7 days have elapsed, you can then open the report, and obviously the log icon is removed. And the 7 days is in place to actually provide healthcare professionals with a chance to catch up on what's happening. And in case of very sensitive information that they really need some time to prep themselves for to communicate to you, those 7 days are there for that reason. Now, some pathology tests are actually exempt from the 7-day rule. Those include, for example, the COVID-19 results and other respiratory infections like the flu, but also INR tests and HbA1c, all of which are available immediately to patients. Now, another great benefit of this would be it becomes more efficient. So there will be less duplicate tests because the data is available much sooner to both you and your healthcare professional. So your healthcare professional will know immediately if a test has been done, won't go and need to call after it to the clinic to find out if anything has been done. Further adverse outcomes and unnecessarily hospital admissions will be prevented. It just really is better for your healthcare. So better healthcare due to improved insight in your health information is also on the map, especially since you have better insight in your test results as well, which means you're better informed. So 4 ways to prevent test results being visible in My Health record are, first of all, actually this red one here, you recognize, we've talked about that. So this is everything to do with setting your LDACs and your RACs up. But there's a couple of other things you can do to really make sure that not only the people who you want your test results to be visible to will see it. So the first one is on your request form for pathology and diagnostic imaging report, there's usually this tick box that says do not send to my health record. You're actually free to tick that yourself, or you can ask your doctor to do that for you. Secondly, when you're getting your tests done, ask the staff of the pathology and radiology clinic to you just do not want it to be uploaded, and they have to really do that. Now, the fourth one here is that you can actually remove or hide test results in your My Health record. To do that, we advise you to actually call our My Health record helpline over here. Yeah, that's the number you'll need to call, and then they'll help you further with that. Now, as I promised, there was this one of the access controls is actually a record access history file or overview. And what you can do here is you can check the record access history at any time for information about the access to your record. And as I said, if you got the alert set on, this is a really good next step to go to if you feel something is not right. The information on your record shows actions like time and date of access, which healthcare provider, organization, or authorized person has access to your record, the action that was taken, and the details of the patient's own access, so of everything that you've done. All your details will be there too. Your healthcare providers cannot see your access history, only you can, your authorized representatives or your nominated representatives with full access. All right, time to go back to some panel feedback. I'm going to stop sharing now, and after this, Tracy will pick up where we were. But first over, I think, back to you, Elizabeth. Is that right?
Yes, that's right. Thank you. And thanks very much for that great presentation. Again, I encourage everyone to thank you in the usual virtual way with their emojis. There we go. You've got a clap. Oh, and two claps, and even some hearts happening there. Hope you're feeling the love.
I do. Thank you.
Andrea and Ali have got some questions. I'm going to throw to you first, Andrea, if you want to pop your camera on, and Ali for your question for Kun. Thanks.
Okay. I'm just very confused with the whole My Health record, having been someone new to it. How does the information actually get into My Health record? And also, I didn't know anything about the existence of the app until now. I'm not very favorable about using apps. So there's too many apps. I feel more secure using a laptop. So is there a way to get into it without going the long way through MyGov? So two questions.
Okay, yeah, two questions. Let's start with the first one. How does the information get into your My Health record? Is that right? Yeah. So at this point in time, that just happens via uploads from healthcare professionals. And again, they're not, with the exception there of the pathology and DI, the diagnostic imaging providers, no one is obliged or has to do it by law at this point in time. So you can request it. For myself, for example, I got a very cooperative general practitioner who's actually more than happy to do it for me. But it's a slow process. It takes time. And it might explain the point you made earlier about not seeing anything in there. That will take time. But once you've registered it, some healthcare professionals actually figure it out themselves, and they just do it automatically. I've had specialists just upload their specialist letters, which I was sent by mail in the past, now just being uploaded up in my health record, and it's there. It's a slow process, but it's happening, and it's also from a healthcare professional perspective a slow and long process. But there is more and more knowledge coming out there. I hope that answers the first question. Secondly, sorry, that was around. Could you repeat it, please?
Existence of the app.
Yeah.
And also, if I prefer not to use the app, is there a way of skipping the long-winded getting into MyGov? And I mean, personally, I don't have a problem getting in via MyGov, but many people will.
I can answer that. At this point in time, without MyGov, I don't see any other way to get in than with your MyGov account. And you need the MyGov to access it on the desktop version, which is maybe easier than doing it via the app for some people, like maybe yourself. But also to get into access to the app, you still need to have actually you need to have your My Health record linked to your MyGov first, and then you can access the app. That's a kind of 3-step process. So yes, that's the answer to that question, I think.
Yeah, thank you.
All right.
Great, thanks. And Abby, you've got a question too. You're going to pop your camera on.
Yep, I do. Thank
Hi,
you.
Ellie.
Hi. Thanks for your presentation. It was
You're welcome.
extremely informative.
Good.
So the question I have is, what accessibility features, pardon me, are inbuilt into My Health record? And how can healthcare consumers use these to optimize their experience and the usability of this digital health tool?
So that's a very good question. I'm not the expert on the accessibility and user experience of the product. And I think I should not cover that today and try to cover it because I'm not the right person for it. However, I think it's a very good idea to maybe do a future session on this very topic. So on particularly the accessibility topic, maybe also usability of it. And I was actually wanting to pose, I'm thinking out loud here, but like, would it be interesting to hear from our audience what they think about it? Give some thumbs up if you like this idea for a future session on this by CHF, please. Can I see thumbs? There's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There we go. Well, I'm gonna stop counting now. That looks good. So yeah, I'm afraid that's all I can answer that question with at this point in time, Ellie.
Thank you. For those that have used My Health record, I'd love you to put in the chat how you found it in terms of accessibility. So people here might have some lived experience of doing that. If you've found it easy, hard, or have a question, pop it in there, because if we do run a session on that, knowing what your questions are helps us structure the presentations for future sessions. Thanks very much, everyone. We're going to move on to our second presentation, and I'd like to introduce Tracy now. So thanks so much, Glenn, who is the Manager Cyber Awareness and Education at the Australian Digital Health Agency. And we will pop Tracy's bio in the chat. And I will hand you over to Tracy, who is going to pop her camera on in just a second and take us through her presentation. Thank you.
Hi, everyone. Hopefully you can see me okay. I'll just launch my presentation. So just 1 second. Excellent. Share the right screen. It always takes a couple of seconds to get things moving. Can you see my screen? Excellent. All righty. Okay. So lovely to be with you. Thank you so much, Elizabeth. We want to talk a little bit about security when using digital health tools today. So look, I think it's important to start with the fact that access to digital health tools really does continue to improve so many aspects of our daily lives, and that does include our healthcare outcomes. However, it is important to know that as digital transformation and reliance continues for businesses, organizations, and individuals globally, so does that market of opportunity for cyber criminals. That also increases with the use of digital tools. Let's move forward. Is it moving forward for everybody? There we go. So the first question is, did you actually know, and I'm not trying to scare anyone out there, but did you know that your health information can actually be even more attractive to cyber criminals than your financial details? Well, they can, because a healthcare data record that is stolen by a cyber criminal could be valued at anywhere between $250 to $1,000 per record on the black market, compared to a stolen credit card or debit card detail, which sells for around $5.40. And this is simply because healthcare records provide so much information that can be reused for activities like identity theft and extortion. While a credit card, it can be replaced, can be cancelled, and it may take a little while, but funds can often be recovered. But if our identity is stolen, it can have ongoing ramifications for us. Sorry, just a little bit of a lag on my end. All right. So look, and the reason we explain that is because I think it's really important to understand that We take a lot of care when protecting the information within the My Health record. The Australian Digital Health Agency has many, many controls in place to keep the data in the My Health record safe and secure. But as users of the system and application, it's really important to understand that, like anything we access online, we are ultimately responsible as individuals for keeping access to our information safe and secure. So that means when using your mobile phone, your tablet, or your computer to access digital health tools, it is really, really important to prioritize our online security. So that is keeping our sensitive information safe from unauthorized access, and that is essential. So when I talk about cyber safety, there are so many different topics that I could cover. However, today we're just going to look at some of those top tips to help keep ourselves protected when we're online. So we're going to focus today on knowing and understanding how to spot scams, understanding what they are. We're going to look at why it's so important to set automatic updates on our devices, that we should be backing up our devices, multi-factor authentication, and the use of public Wi-Fi. So they're all the things we're going to have a quick chat about today. When my slide moves forward. There we go. All right. So I want to start with phishing. So I think I would be incredibly surprised if anybody in the call today had not ever received a phishing email, like a suspicious email, a phone call. We've all had those phone calls, or an SMS message. But just to refresh, phishing is when cyber criminals pretend to be a known company, such as a government organization. It could be your bank, and they'll send you messages trying to trick you into completing their requests, which are normally to click on a link that will take you to a fake website with their intent to steal your username, your passwords, or your credit card information. Or they'll try and trick you into opening an attachment, such as a Word document, a PDF file, or what we call an executable file, which is in fact a computer virus, or more commonly referred to as malware. But the question is, why are phishing attacks so successful? Well, there was a report from the State of Fish that said that 44% of us as victims think an email is safe when it contains familiar branding. So almost half of us here today, we really need to learn not to trust something just because it claims to be from Australia Post or Link Tolls, for example. Secondly, 1 in 3 people actually admit that they take risky actions, such as clicking on a link or downloading malware when faced with a phishing attack, because it's really easy to say, I won't click on that link. But when we are faced with these messages, we are often making some very unsafe choices. And it really doesn't help that cyber criminals use those known brands to lure us in, but they will also use other tactics like a sense of urgency or some other emotional hook, such as fear, in order to get us to click on that link. So this really is a mindset when we're interacting with electronic messages, that we really need to start critically analysing everything that we are receiving to decide whether it's suspicious or safe communication. So, thing to know about phishing attacks, they aren't targeted. They are sent to thousands of people at a time. Phishing attacks will also capitalise on what is happening in the media or current events. I actually have on my screen a recent phishing example that has been circulating. So ScamWatch actually reported that the MyGov-related scams were up 160% since 2023. So that's huge. But with awareness training like we're doing today, we can really start to understand and identify the red flags that will show us that this is a scam. So let's have a quick look at those warning signs. So the first one is take a quick look at the email address. This one is incorrect. It is not a MyGov email address. And I promise you, if you have a look at most of your email communications that come through, if you go straight to the email address, you'll be able to tell that it is not coming from the legitimate sender. These emails often have generic greetings. So dear customer, hi, hello, how are you? They are not addressing you directly. So that's also your second flag. The third flag is they are unsolicited or unexpected. And now this is how most people get caught out, okay? Sometimes it's just simple curiosity that gets the better of them, or they're busy, they're tired, they're doing something else. This unexpected email pops into their inbox and they open it up and they complete the action, okay, such as clicking the link or downloading the document. But in this case, they're offering a refund, and people can get quite excited about a refund, but that ties in with the next one. Is it too good to be true? Because if it is, it will probably be a scam. And does my gov regularly send out refunds? No, they generally do not. So this is where we need to start to critically analyze the content and to start to think whether this is a legitimate email or potentially a phishing email. The next flag is we now say may contain spelling. When I first started doing this training a long time ago, we always said look for spelling mistakes because they were always in phishing emails. But however, experts are now leaning towards saying that this is not an indicator as much as it used to be. And that's simply because cyber criminals now have access to AI tools and those free ChatGPT tools, and they will use them to actually craft a lot more polished text messages and emails. So they're getting a lot better at how they look, and they're getting a lot of that assistance and making sure they look a lot more professional than they used to. So they may contain spelling or grammar or formatting errors, but it's not as common as that used to be in indicating whether it's a phishing email. And look, 9 times out of 10, it's going to have a malicious link. So please remember to, or an attachment. So never access your accounts through a link that's actually emailed to you. Our suggestion here is always go to the official website or the app that you might have downloaded on one of your devices. If you want to check on something that might have been emailed to you, go to your to the official website through your app or from your browser to actually access those accounts. And that will go a long way in protecting you. But in this sample, just to show you, if you actually did open the email, you'd be taken, click on the link, you'd be taken to this particular website, which is a phishing site. And any details you entered in here would be stolen. Again, now this is why it's so important that we talk about this today, because hopefully after today, you're going to have a few more skills to be able to identify phishing emails and hopefully not reach this particular stage. But if you did, the next step for you to do is now take a look at the address bar right at the top of the screen. Hopefully you can see that there are actually some clues up there. So and this one actually says phishing. I don't know if you can see that up in the address bar, but some will even say dangerous. So your browser will actually tell you that, okay, and tell you it's not the correct website. And we'll talk about this a little bit later, but this is why it's so important that we actually keep our software and our systems up to date. So when our systems ask us to update our devices, which sometimes we go, oh, we'll do that later, it's really important to do it because only the modern browsers actually have these features to tell you that something is fishy. So it's something that we need to be aware of. But that's really great that these new features now appear. Okay. So I just wanted to show you, so that's phishing, that's email. We also have SMS phishing, or what we call schmishing. Okay, so some fun words here, phishing and schmishing. And this is another key way that cyber criminals will attempt to capture our access codes, our passwords, or to try and compromise our accounts. And I think some of us will actually be very familiar with these SMS scams that you see on the screen because you may have actually received them yourselves. The most common ones that we've got up here are the hi mum, hi dad's email scam. This one's still circulating. So basically the cyber criminals message you saying, hi, my phone is dead, I have no money, please help. This one is so successful. Australians have actually reportedly lost more than $7.2 million to this particular scam. And we also have the unpaid toll scam that you can see on the screen. These are actually samples sent to me by a friend. If you actually click on the link in the toll scam, you are taken to the little page you can see on the screen where they ask you to pay the accounts. So my friend actually provided not one, but 2 credit cards before she actually realized this was a scam and contacted her bank right away. To move. Okay. And we also have another couple of MyGov SMS scams on the screen. Now, the point here is to always question your text messages, okay, especially ones that come out of the blue. Are they solicited? Are they offering refunds? Have they got links included in them? And just like when you get a phishing email, treat your SMS messages just the same. If you're unsure if the message is legitimate, contact the company in question by using a trusted source, okay, to get to verify whether the information is correct. One of the best things to do is that the Australia Post, I get a lot of those scam emails all the time and scam messages on my phone all the time. So I have the Australia Post app, and I always check if there's a message in there, because that's where I'll find the truth. Okay, so how do we spot a scam? So being aware of scams and understanding those red flags of suspicious communications is absolutely essential, as falling for these scams could actually then lead to your devices being compromised, and then therefore potentially put your information and access to your different systems and applications at risk. So please remember, before clicking on any links or any attachments or sharing any personal information, please think, firstly, are your emotions heightened? Is that information in that message making you feel curious, or is it making you feel stressed? So if that's coming up in any of those communications that you're receiving, then please consider that as a major red flag. Did this message come from a legitimate sender? And again, remember, like we said before, it may appear to be from your bank, another government organisation, Australia Post linked tolls, but check that email address, because it will tell you whether it's actually coming from an official email address or whether it's coming from somebody random. Did my colleague or my friend actually send this message to me as well? So especially when it comes to the hi mum, hi dad scams, things like that, or if someone's trying to ping you on Facebook, getting you to help them out and change their access codes and things like that. Because remember, they may have been hacked, or someone may be impersonating their accounts. How do you find out? How do you check? That old-fashioned way. Pick up the phone or message them directly with details that you trust, that you've sourced independently. Okay, that's the key as well. Don't rely on the information that's coming through on those messages. It's a website that they're trying to send you to. Is that correct? So before entering any personal details or credit card information on a website, always make sure that you're actually on the legitimate site. And don't forget, does this offer sound too good to be true? Because if it does, it likely is. Okay, that's one of the best ones. And are there links or attachments? Okay, and again, if they are, please do never open a link or attachment unless you're absolutely certain they are safe. If you're questioning the validity of those links, again, go back, contact the sender using a purported sender, using methods you trust so that you can verify whether the email is actually sent to you. And can the person that is trying to contact you prove their identity? Again, if they can't, do not do what they're asking for. Please cut off all communication, and again, contact the company or the person using trusted information. Okay, so now we're going to have a quick chat about multi-factor authentication. Like, it is super important to have strong passwords for all of our online accounts, as they really do help to protect against unauthorized access. And the latest advice for creating strong passwords is to simply choose 4 words that are unrelated to each other, such as turtle, cake, and shoelace. That's a great password. If you'd like to add further complexity, though, then you can always add a number and a special character, because some systems will actually ask you to do that. But the strongest way to create a password is just choose 4 random words or 3 random words and mash them together. So long is strong. However, we've got to remember, passwords are no longer enough by themselves to protect our online accounts. Okay, so this is why multi-factor authentication, or what we call MFA for short, it is really important, because it provides a necessary added layer of protection just in case one of your passwords has been compromised. So what MFA does is it requires you to use a combination of 2 or more of the following factors to access your account, such as something you know, which could be like a PIN number or a password or a passphrase. It could be something you have, so it might be like a physical token, such as an authentication app, an SMS message, or an email. Or it could be something that you are. So it could be a fingerprint, could be a facial recognition scan, or an iris scan. But today, most accounts such as MyGov and your banking accounts, they require multi-factor authentication by default. So it's really important, though, if any other account offers multi-factor authentication, even things like your social media accounts, please set that up. Okay, please consider using it wherever it is offered, because it will always give you an additional layer of protection if someone is trying to access your information or your accounts. Our next tip is that, look, cyber criminals, they're always looking for ways to get into our devices, okay? And one of the most common ways for them to do that is through what we call exploiting weaknesses in our software, or this is also called vulnerability. Much like a thief attempting to break into our home, cyber criminals are always going to look for the easiest way to get in. So when your software is not up to date, it really is like leaving the front door open to your home or leaving it unlocked. So another highly recommended step to protecting yourself from cyber attacks is to keep your devices and your software up to date. So when they ask for those up-to-date updates to happen, you say yes, please, because this ensures that you are running the latest versions, which is a great fix for any known bugs or known security vulnerabilities in any of the products or apps that you may be using. And another tip here is, if possible, set all your updates to happen automatically, so it just seamlessly happens. Mine always happen at night time. They seem to come on at night time when I'm going to bed, so it's great. So when I wake up in the morning, my phone or my devices have been updated. Another tip here too is to always back up your important information on your devices. So a backup is simply a copy of all your important files. It could be your photos and your videos or your documents. And instead of storing it all in one place, like on your computer or your phone, you keep a copies of that information somewhere safe, okay, such as the cloud. And having copies of your important data is really important, because you can then successfully restore that as a nice protection measure. And this ensures that if something happens to your device, such as fire, flood, theft, loss, or goodness forbid, a malware attack, you won't lose your important data and those very precious memories. We will share this link with you after, but the Australian Cybersecurity Centre website has some fantastic step-by-step guides on actually how to do that. So we will share this link with you following this session today. And our final tip is to be really wary of public Wi-Fi. So public Wi-Fi hotspots are found everywhere. They're at our local shops, the cafes, hotels, airports, just for example. And look, they are a very convenient way to access the internet when we are out and about, or we have poor reception, or if we're traveling. But there are many risks when you are using public Wi-Fi hotspots. These can be accessed by anyone and are often free and unsecured. Therefore, these hotspots could actually be very attractive targets for cyber criminals who may try to use them to steal your passwords or your sensitive information. So please stop and think before connecting to free Wi-Fi or hotspots. Use your own mobile data if you are out and about, or wait until you are somewhere where you can access a trusted Wi-Fi network. When visiting websites, again, always double check that the site's web address. So make sure that you're on the correct website. And again, always think about what you are accessing via a public Wi-Fi hotspot, because there are apps that you think may not contain much personal data actually do, such as your Facebook or other social media websites. Look, in summary, the security of our information and protecting ourselves online really is something we all need to play a part in. So please take today's tips and share them with your family and your friends. We have lots of videos and resources available on the agency's website, which we will share with you after today. They do go through these tips and provide some more detailed information for you. And like I said, we'll share them with you after today's session. But yeah, please think about these tips, because it's all about how you're protecting yourself online, and that will then help to protect any information you have in any app or any online information you might be having access to. So thank you. I'll stop sharing my screen now.
Fantastic. Thanks so much, Tracy. I'm sure folks would like to send Tracy some love to thank her for her presentation. I know a lot of people were commenting in the chat while the presentation was on, Tracy. saying how valuable the information
Thank you.
was.
So I couldn't
you
see
were
the chat
providing.
while I was talking. Elizabeth, thank you. Have a
No,
look.
That's fine. You can have a look, but people saying, almost like you should be bottling this and selling it at the local 7-Eleven, right?
Yeah.
So that's terrific. So we're going to move on to our Q&A. We've got a few questions. Some people have popped questions in the chat that have been answered, some not yet. So I'd encourage folks, if you've got a question, now is your time to pop it in the Q&A. Because we've got time, we've got about 20 minutes, so it's plenty of time to answer a few questions. I'd also like to introduce James Mackay. I say Mackay, I don't know if you're Mackay or Mackay, James. Let me know.
It is Mackay.
Fantastic. I've got a Mackay friend, so I was just going with that. He's the Director of Cybersecurity Operations at the agency, and he's going to join Andrea, Ali and I for the Q&A. So I'm going to start just while we're encouraging people to put their questions in the Q&A with you, James. We've just had this great presentation from Tracy and sorry, as we say, Andrea and Ellie, feel free to pop your cameras on about all these things, scams and so on. When we think about My Health Record, how could it be vulnerable to being hacked in any way? What should we be concerned about? What should we watch out for?
Yeah, so that's a really good question. And as you mentioned, Tracy just went through some of the fundamentals. So as a consumer, you should be very vigilant, looking to do those updates that she said. I would always make sure, using your browser absolutely updated. That's how you might be using it, using the My Health app. I will say nothing is stored actually on the phone for the app. Okay, it is an interface that goes through the My Health record, so very safe there. But taking those steps, using multi-factor authentication, doing the updates, mate, and be on the lookout for unusual things. As Tracy said, you might start getting emails from unsolicited emails from different sources, things like that. If you notice something that's unusual, then that's a sign. It's the same with your banking apps and your banking sort of things like that. What you want to be doing is you want to be using the same devices and making sure that they're really secure. Make sure your password is we prefer the term passphrases, so it's really long. A passphrase is also a lot easier to remember than a password. Okay, and if you've got the option, and this applies to any applications that you would have on your phone or you're doing via a laptop, use multi-factor authentication. So this is where you get the prompt from your phone. You might be using a service there. Again, banks have been doing that for a while. It's now start of the things, but that is a really strong indicator. Single factor authentication is just like a username password, not as strong. And there's a lot of things that are circulating. And I guess the bad guys, they look for really guessable ones. So it's got to be something that's complex. And if you're in any doubt at all, change those details, okay, as you would if you contacted a bank or similar financial organization. So that's really key, okay, is to have that those strong principles there. But if you are concerned, if you think something has happened, you can always contact the call center and things like that, and it can be looked at. So yeah,
Right.
that should help.
Tracy mentioned, keeping things up to date. So we'd say the My Health Record app, is it important to make sure that app is up to date?
Yeah, so look, it gets released, and I guess not on the consumer side, but on the infrastructure that we manage. And I've worked in this space for a long time. We do have security professionals that are testing for, emulating what the bad guys are doing, okay, what the bad actors are. We are looking for those flaws. When we find them, we fix them, okay? Every computer system these days is going to have those vulnerabilities. You hear about them occasionally on the news, sometimes stopping, shipping companies or things like that. You do hear about those. They come from two forms, usually from a vulnerability, but how they're getting there is like Tracy explained, from things like clicking on phishing links, those type of things that will get some of those details from you. So you just have to be a little bit cautious, be in the right frame of mind. I think Tracy said do you have heightened emotions and things like that in the phishing? I'd also say don't do your critical things when you're tired as well. That's often when people get caught out as well.
Yeah, right. Thank you. Thanks. Ali, I've got a question for you, which is, having heard all of this and looked at how My Health Record works, if it was being really used to its fullest potential for someone with chronic disease, what do you think that would look like? What could it do in its best version? What are you hoping for?
So look, oh, sorry, was that for
That was
Ali?
for
Sorry,
Ali, but
Jane.
you're welcome to join after you've got some ideas too, James. Happy to hear them. Go for it, Ali.
Yeah, go ahead, James. But thank you, Elizabeth. So, as somebody who lives with chronic conditions and has done for many, many years, if my health record was available and being used to the fullest extent possible, for me, it would be this centralized, secure place where all my health related information was stored. And whenever I saw a new healthcare provider, I could just ask them to refer to my record, and all the information they needed would be there. I, as a healthcare consumer, wouldn't have to be telling my story for thousandth time or having to have the extra stress of perhaps educating somebody or having to do extra homework and prep work ahead of an appointment, making sure I had all my documents ready. And then having to spend time in appointments going over those documents that could be better spent, discussing what that provider might be able to do for me. So I think if used correctly and to its fullest potential, my health record could really save healthcare consumers and providers so much time and effort, and just make the whole process more seamless for everybody.
Oh, fantastic. Thanks, Ali. Now, Andrew, I think you've got a question for James.
Yes, I do have one, James. I'm just wondering, being a new user, when I'm with a clinician, how do I say to them or give them access to use my health record? And at the same time, maybe I'm in emergency and can't verbally clearly, give permission. So there's the two parts of it. How does the clinician access the information and, authorization to access the information?
That's a great question. So you as the user give the authorization. I think that was discussed a little bit earlier in the presentation there. So you can control which clinician has access to it. So it might be, for example, you might be very comfortable with your GP, but you might not want to share those results with another in another clinical setting. So you actually get to choose the controls of those. So have a look at the access controls within the system. Your second part is a very valid question as well, because there is, and what we would call a break glass type of function. So if you were to present at an emergency department and say you're like me, I have an underlying chronic condition as well. I need a certain medication. If they were to take bloods without knowing that, they might give me the wrong treatment. So under very, very strict sort of control there is that ability to have some emergency access in those type of settings for emergency departments. There's a lot of paperwork associated with that, and it's not too automatically, and we have a lot of auditing associated with that particular aspect. It is not used that commonly though.
So can I just ask for clarification on the first part? So does that mean I have to go into my own record and type in for the doctor, or it's a first time going to a specialist, that I have to actually put that information in the record while I'm sitting with the doctor or the clinician?
So I'm probably not best placed to do that because I don't spend a lot of time on the consumer side. I spend a lot of time on the infrastructure side of things, but there are control settings there. Okay, so you will be able to decide who has access to
So
to
if
new
I'm
access
going to a
records.
new specialist, I would ideally type in access for that specialist perhaps before I went, so that they can access it.
Yeah, so specialists and hospitals access the My Health record system differently than consumers, okay, because obviously they're dealing with a lot of different consumers all the time there. So they are set up to have that, but you as an individual can override that.
Okay, thank you
So
very much.
there's two bits, I think, Andrew. You can control who you don't want to have a look at it. So let's say
Correct.
you're going to a specialist and you didn't want them to have a look at it. You could go in and say, this record can only be looked at by my GP and I'm putting a pin on it. If anyone else wants to use it, I'll have to give them that pin, they're allowed that, and then they can get access. Otherwise, if someone is, say, in a hospital, the hospital will have access, so they'll be able to see. Unless you've said no, they'll be able to see.
Okay, thank you. As a newbie, now I'm going to go back in and have a better look.
Yeah, that'd be really great. Have a play.
Thank you.
We've got some more questions that I want to get through, and a lot of them relate to information being in your My Health record. So I can say that this is probably the biggest issue we hear from consumers, not that they have an issue using it, it's that no one else is. So that their GP, their pathology user, their pharmacist, their nurse practitioner aren't putting stuff in. This has been a problem since the beginning, and I'm going to be a bit political about this in a way that my agency colleagues can't. So there are some health professionals who are of the view that unless they're paid to do this, they refuse to do it. Okay. Now we could talk for a long time about why would they do that, but that's just an industrial decision. So they're negotiating for extra money, right? Give me extra money and I'll put it in, right? That's why a lot of times the information's not in there. The current government's not very happy with that. So it started first with pathology and imaging, because that's where a lot of people say, I wish my results were in there, because I had to have 2 blood tests. Because when we went to see my specialist, we couldn't find the results of the one I had last week. I had to pay for it. I had to be jabbed twice. This is not okay. That's what we hear the most. So the government's now going through a process of saying, pathologists and imaging people, you won't get your Medicare rebate unless you put it up in My Health record. The only exception being if the person has said, I don't want you to do that. So what should happen now is all that information will start flowing into your record. No one's going to put everything you ever did in the past in there, but from now, your results should be there. And to be honest, a blood test from 5 years ago, most likely, you don't need that anyway. So the industry itself is not very happy about this, it's fair to say. And, you know, there'll be a lot of political positioning happening over this. The government's made it pretty clear that this is the beginning. They intend, if people don't start doing it, to mandate that they're going to do it, which I think you can hear from your questions and the comments in the chat. This is exactly what you want as consumers. It's your health. You need access to your data, and you don't want it to be hidden in a way that you can't find it. You want to be able to, I mean, being an ED and being able to show your phone to someone saying, these are my results, this is my medication, this is what the discharge summary was last time I was here, is incredibly powerful for you as a consumer, and even more important if you're advocating for somebody else who you've got. I've got 3 kids. They've got all my health records. If I had to go into hospital and remember exactly what happened for which one, it'll be really difficult, right? But I can look at them on my health record and say, this is this child here, this is this issue, this is when they're immunised, or this is when they were last at the hospital. Super important. So the government is pushing the industry and these other groups to do it. They are resisting, okay? So anytime you get the opportunity to say this is a really good idea and why isn't happening, in any forum, I would really encourage you to do that. The more the community say yes, and if you see the government making these moves, the more that you can get on, I don't know, comments on the online newspaper or LinkedIn or wherever you go to say, I love this, the more confident the government will feel that it's moving in the right direction. Because right now what it's getting is industry and clinical groups saying don't, and not necessarily a strong voice from the rest of us, the other 26 million of us, saying do, 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 do. So the more that you can do that and advocate that your information is in there, the better. If you go to your GP and you want your information put in there, you can say, I'm making an appointment for you to summarise my medical history and put it in my health record. That's all I want us to do at this appointment. Now, I realise if you're not being bulk billed or the appointments are expensive, that might be tricky for you to do because you have to pay for an appointment. You might decide it would be worth it. Once it's in there, pretty much every clinical software, it's just a touch of a button to then upload what happened today. the biggest job is putting your summary in at the start. And some GPs will do that just while you're having a consultation with you. Others might require a bit of encouragement, like saying, I am setting up a meeting for us to do this next time. Pop it in there, and then that summary is there not only for you and your GP, but for everyone you're in contact with. You go to see a physio, a new specialist, you end up in hospital, you're travelling interstate and you need to see an after-hours clinic, you'll have that information there. So it can be in the palm of your hand or on your laptop, whatever you like. So I'm going to go to the Q&A, but that seemed to be a current theme across things. Why isn't this already happening? What can we do and how fast is it going to happen? Things can only work at the speed of trust, we say. And I think that's, if I'm going to be fair, sometimes health professionals don't feel a lot of trust in the system. They might be worried that James doesn't know what he's doing and that the cyber prevention's aren't in there. We're confident in you, James, but people, especially people without technical backgrounds, can be very worried about this. They may be arguing industrially that I should be paid. This is an extra job. I don't agree with them. We could talk about that another day, but I don't agree it's an extra job. Or they may just simply not know how. Well, it's not that they're against it, they've just never done it and they're busy, so they haven't done it and it's put it off, like the rest of us put things off. So it can be a mixture of I don't want to, I don't know how, or I'm standing on my dig because I want a different way of engaging or interacting with this. The more the community says this is not optional, the more that the mood will change both within government and also in those other areas. So there are a few questions here. I'm going to throw them either to the consumers or also to the agency folks. And if one of you is better to answer this, Kun or Tracy or James, if you know you're the right person, just feel free to say that's me. Perhaps you can all pop your cameras on. I've answered the question, some of the questions about when is it going to happen. Let's go to the start. So someone's asking, what's the difference between the Medicare MyGov app and the My Health app? Who would like to have a go from the agency in answering that question? What's the difference between your My Medicare app and your My Health app?
I can provide a brief answer because I actually did some security testing on the Medicare app many years ago when it first out. So that's really looking at the coverage of services. It's really designed around the Medicare coverage. Looking at I guess some of the invoices and things like that, and how much you're going to get back on your benefits. So that is administered by a different agency than ours. So that's Services Australia that manage that application.
Great, thanks. Someone's asked about the do not upload for PATH and DI and said, what about if your doctor's ticked it and you want to untick it? Are you able to do that? Does someone want to speak to that? Is that something?
Yeah, I can talk to that.
Thanks,
It's a very good point, and it's interesting. Now the conversation is coming up around this very topic of like privacy and access controls. There's a certain perspective on how we thought it should work as an agency, but it turns out that there's so many different scenarios to the story, and this is a very good one, I find. It might happen that indeed your GP has ticked the box because they do not want to go through the effort, or whatever the reason is. Just one option. What can you do? Well, you can ask them to make a new form. Definitely, that you're absolutely in your right to do that. If there is protest, another potential thing that you could consider, and this is just an idea, I don't say you get cooperation, but it's actually when you're at the PATH and DI clinic, say that there's been made a mistake. I was actually allowed to do this the other day, and you just put a little paragraph next to it and cross it out and a little signature of yourself, because you're the key holder of that information. You're the person in charge of that in terms of what gets uploaded or not.
Great, thanks for that, Kun. Giselle's asked a question about old information. A couple of people have asked, they've got lots of records. I might just stay with you for a moment, Kun. And they're thinking, well, could I get some of this old stuff put up? Now, I know that having your summary put in is one way to do that, by having your health summary in there with your GP or whoever your key provider is, your the paediatrician, whoever it is one way to get a quick sense for a new practitioner of where you're at. But is it feasible to go to your GP, for example, and during a session say, I've come here for a session, I want us to look through some of my key events and want you to upload some event summaries or some general summaries in about these events because I'd like them in my record. Is this something you can do?
Yeah, I think your suggestion sounds good. I have no experience with it though. So, and it is actually quite a tricky one. We are aware, we've come across this more times that people say, but what about the rest of my medical history? That's not in there, right? That's what this is about. Why can't I see that? The reason is that at this point in time, we do not have any functionality to do that. I don't really know why. I can't really give you that answer to be honest. But I think a workaround to that, and of course, apart from and I speak from my own experience as well. I got chronic disease as well for more than 30 years. Diabetes to be exactly, but do I really want to know my HbA1c 25 years ago? And I think this point was made earlier before. Not really at this point in time, but yeah, I think that's all I can give as an answer at this point in time. Yeah.
Great, thanks. There's also a question, I think Howard put it in the Q&A, thanks Howard, which is, are there sanctions for health professionals who look in someone else's apps or records? Say, for example, I'm curious to know if the Prime Minister's on any medication or has recently been to hospital, and I'm a doctor, get in there and I happen to know his Medicare number because he was waving it around during the campaign and I took a screenshot. What happens if someone inappropriately accesses your record? Because as you mentioned with emergency departments, if you're unconscious, they can smash and go in and look and see if you've got a record to know that you're, say, allergic to penicillin or that you have diabetes. What's to stop someone doing that smash when they're not meant to? What happens in terms of surveillance, I suppose, but this question was particularly about, can they get in trouble? I don't know if that's you or somebody else that can answer that.
James, you want to have a go?
So there are
Yeah.
sanctions. You're quite right. Okay. There is obviously it's a very heavily audited system as well, right? So we can look at that functionality. We can see what clinicians, are looking at those records. We can reconcile that information and look to it. So, and every sort of emergency break glass type of access is fully audited every time. It doesn't happen that often, I'm going to say, because it's a rare event, but every time that does happen, it does happen. We also so everything is under the My Health Record legislation, and there are sections in there, and there are responsibilities for clinicians to make sure that they're safeguarding the information there. Part of my team, we run what's called Security Operations Center. We are looking at the telemetry, right? The information, so not the actual information, but audit information. And sometimes we can see, a particular site may have, or they might actually inform us that they've had ransomware or something like that. We will take action to disconnect their services from the My Health Record until things are fixed. All right. So it's something we're doing, sort of all the time in the background for those. And I will say in those cases, it's not the clinicians. They've become a victim of ransomware or had a phishing event or something like that themselves. Okay. So it's not only consumers, it can be organizations that fall victim to those things. And I will say, just on that point, some people feel that they're in the wrong or something like that. The ACSC, the Australian Cyber Security Centre, which Tracy mentioned before, are more than happy to help. We'd rather have like a call out, the fire brigade a call out to a fire alarm and no fire than not at all. Okay, so they're always there and to assist individuals as well. So reach out, but there is a lot of things the agency does to look and to make sure that those things are not happening. And again, we're always strengthening our systems as well. We're always applying those updates again that Tracy mentioned that consumers should be doing on their individual devices.
Right. So a little bit going on the chat, Giselle, and I think we'll take your point that some old records are really important. It's just if there's a bulk of them, that you wouldn't want to put them all in, and like, you know, 20,000 blood tests over your lifetime. And you can upload stuff. So if you were tech savvy, you could put those in yourself. Though I realise that not everyone can do that. And Howard, thanks for clarifying. Howard's question was, what about if one doctor, for example, using this example, really needed information and another doctor never put it in? Would there be a disadvantage or a kind of a fine for saying, why didn't you put that critical information in my health record? There isn't at the moment, but maybe in the future that would come. First of all, we've got to get people putting the information in before we can start to say, why didn't you? Because while there are many health professionals that put information in, there are hundreds of thousands of bits of information that go into my health record. It's still not enough. We need more. Now, we're nearly at the end of our time, folks, and I don't want us to rush out the door. Hopefully, we've answered most of your questions, but perhaps not all, and I apologise for that. But we'll look at these, and when we run the next one, we'll make sure we cover off on these. And if there are any that are easy to answer, simply by including a note in the email we send out with our YouTube link, we can do that as well. We're going to do another poll now. So we'll pop that up in just a moment. Thanks, Shannon. Ask people if they think this was helpful and they'll be able to navigate better now than before. So it's just a simple yes or no. I'll give you a minute to do that. Thanks, and Shannon will put the results. Oh, look at that, 100%. Wow, gee, you've got an A+, everyone. Well done for everyone for an A+. I think for those of you who are getting paid for this to your agency roles, you could take that to your boss and ask for a pay rise. Look at that, 100% KPIs met. So we've got a little bit of wrapping up to do. First of all, we really encourage you to stay connected with CHF. We do a lot of work not only in the digital health space, but in many other spaces. There are lots of ways to do that. So for those of you that are active with socials, there's our newsletter, which Shannon's just put in the chat. Thanks if you don't get our newsletter. We're also active in places like Facebook and LinkedIn. So you can access those as well. They're our handles or the names, but you'll probably find them by just putting search into a search bar. We do all kinds of things with consumers. There are opportunities for you to do some paid consumer advocacy, as well as learn more about things. And we have more webinars with the agency over the coming months and years. So if you thought this was good, there'll be more. We also have our consumer assembly where we're asking people who are interested in working with us more regularly to put their names forward and become part of a group that we're going to have that will work with us in identifying all kinds of important issues for consumers. So that might be something you'd like to do too. As you know, a recording of the webinar will be on our YouTube channel. And so you'll be able to look at that, and we encourage you to share it far and wide. I'd also like to thank our experts, Andrew, Ali, Kun, Tracy, and James. So let's give them lots of love, folks, who are sharing all their information with us. It can be a bit nerve-wracking when you've got to do this. Oh, gee, you're getting a lot of love. I hope you're feeling it. And very hard to know if people are enjoying what you've said and if it was helpful. But hopefully for those of you that were presenting today, you can see both in the chat, the questions and the emojis, that people are really grateful for your wisdom and your expertise and for the opportunity to learn a bit more about what is very important, which is the privacy and security of their health data. I'd like to thank everyone who came along today. Really valued all of your interaction. We hope that you didn't feel like you're just sitting at a screen, but actually really taking part in something together. And we'll leave the webinar on for a few minutes now. We always love your ideas about what to do differently. Did you like it, not like it? What can we do at the next one? If we do something accessibility, you've got an idea, tap it into the chat now, because we like to get your thoughts and use those to determine where to from here. So the more you can share your ideas, the more we can actually then do what is best for you. So I'd like to say thank you to everyone, and I hope to see you again sometime soon on the webinar with us, and everyone enjoy the rest of your week. It's nearly the weekend. And the love's still coming in, folks. Look at that. Yes, you're welcome to turn your cameras off and go about your business. But thank you everyone for attending and for presenting. And similarly, love you to share the link to the YouTube on your own socials too.
Thank you so much.
Okay, bye folks.
Thank you, everyone. Bye-bye.
Thank you all. Have a lovely weekend.
Thank you.
Thank you.